Good afternoon to everybody. My today's lecture is on Spina Bifida. Spina Bifida, it means split spine. That is, when the spinal cord of the baby, of the embryo, is splitted at any point. It is a congenital birth defect that results from abnormal fetal development of the spinal cord. It is congenital birth defect and therefore it occurs in the embryonic stage of the baby. It originates in the first stage or in first 4 weeks of pregnancy. When zygote formation takes place after a successful fertilization of the sperm and ovum, a zygote will be formed, and in the very first day or within the first 4 weeks of pregnancy, that is within 1 month of pregnancy, the spinal cord will be affected, that is, the spine will be splitted. Often before a mother even knows that she is expecting a child, because by first day or within first 4 weeks of successful fertilization, a mother may not be informed. She may not know that she is expecting a pregnancy. At about 26 to 27 days, this neural tube fails to completely close for reasons not fully understood. This failure results in various forms of spina bifida, frequently involving some paralysis of various portions of the body. Due to spina bifida, various parts of the body is affected and is paralyzed, depending on the location of the opening of the spinal cord point. It may or may not affect IQ of the affected baby. In this defect, nerves that relay sensation and control movement in the legs, bladder and bowel are damaged or incompletely developed. So, some problems like sensation, like control of movement in the legs, bladder movement, bowel movement, etc. These are either partially damaged or completely damaged. The child may be affected from hydrocephalus, that is storage of cerebrospinal fluid in the brain, causing the macrocephaly, that is a large head, or infections in the nervous system. It may be affected, the child may be affected from hydrocephaly or infections of the nervous system. The spina bifida is usually classified as spina bifida occulta or spina bifida cystica. What is spina bifida occulta? It is a hidden spina bifida. It is a very mild form in which a small slit, that is opening of the spinal cord, is present in one or more of the vertebral columns. In some cases, It may manifest itself as no more than a small cavity, that is dermal sinus, between two adjacent vertebrae, indicating that they had not fused properly. A hairy patch or birthmark may be above the defect. In another form, the spinal cord may end in fatty tissue, which extends through the spinal column and forms a bulge under the skin. In mild form, no symptoms occurs, but in severe form, several vertebrae are involved and a fatty area, hairy patch or dimple in the skin over the defect is noticed. And bowel, bladder and motor problems may develop. Three major problems: bowel problem, bladder problem and motor problem. Then the second type is Spina bifida cystica. It is manifested type of Spina bifida. It is a malformation of the spinal column in which a tumor-like sac herniated out through an opening or cleft on the infant's back. Again I am discussing that it is a malformation of the spinal column in which a tumor-like sac herniated out through an opening or cleft on the infant's back. It is again of two forms: Spina bifida meningocele and Spina bifida myelomeningocele. So Spina bifida occulta, that is the hidden form of Spina bifida, is only of one type, whereas the Spina bifida cystica, that is the manifested form of Spina bifida, it is again of two types: Spina bifida meningocele and Spina bifida myelomeningocele. In myelomeningocele, meningo refers to membranes and cele means a swelling or cavity. So in the meningocele type, the sac contains spinal fluid but no nerve tissue. It may cause minor muscle paralysis or incontinence if nerves protrude into this sac. In the myelomeningocele, myelo refers to spinal cord. In the myelomeningocele, the type, the sac does not contain nerve tissue. It is the most serious form, results in weakness or paralysis in the legs and lower body, an inability to voluntarily control the bladder or bowel, and the presence of other orthopedic problems like club feet, hip dislocation, etc. Myelomeningocele are again of two types. In one type, a tumor-like sac is open, revealing the neural tissue, and in another type, sac is closed or covered with a combination of skin and membrane. The exact cause of Spina bifida is unknown. Till we don't know what are the exact causes or what is the exact cause of Spina bifida. But the geneticists and the doctors, they believed that a multifactorial trait, that is both genetic and environmental factors, play a role. Parents with one child with Spina bifida have an increased risk of giving birth to another child with Spina bifida. So if my first baby is affected from Spina bifida, there is every possibility that my second baby will also be affected by Spina bifida. It is also possible that certain harmful agents taken by the mother prior to or at the time of conception or during the first few days of pregnancy may be responsible for this type of defect. Some teratogens like radiation, maternal high fever, and excess intake of glucose may induce malformations in the spine. Some teratogens like radiation, radioactive rays, or radioactive substances, maternal high fever during the onset of pregnancy, and excess intake of glucose may induce malformations in the spine. Other causative factors include congenital rubella infection during the first trimester of pregnancy and chromosomal abnormalities. So, rubella infection is the most dangerous form of infection that, if caused during the first trimester of pregnancy, that is within the first 3 months of pregnancy, then the baby may be deafblind or blind with MR or blind with CP, or may be affected by Spina bifida, or in some cases their heart, their lungs, that is their cardiovascular system, their spleen and their liver may also be affected. The chromosomal abnormalities. Till date, we are not very much clear about which type of chromosomal abnormality or which part of the chromosome, which part of which number of chromosome is caused by Spina bifida. Folic acid, that is vitamin D deficiency, and other nutritional deficiency may also cause Spina bifida. So, and other type of neural defects also may be caused due to vitamin deficiency or nutrition deficiency. Then the questions arises: as the rehabilitation professional, as the parents of the baby having Spina bifida, as the community members of the baby having Spina bifida, or as the teachers of the Spina bifida baby, what role we can play to provide intervention services, intervention facilities for this group of children. The first one of intervention is identification of babies with myelomeningocele. Can be done during pregnancy by the analysis of the mother's blood for the presence of a specific fetal protein, that is alpha fetoprotein AFT. So, by testing the mother's blood during pregnancy, and which material? Now, specific fetal protein, that is alpha fetoprotein, we may identify that the baby is affected by Spina bifida. Alpha fetoprotein leaks from the developing child's spine present in the mother's womb into the amniotic fluid of the uterus and subsequently enters the mother's bloodstream. If blood test is positive for AFT, then ultrasonic scanning of the fetus may be performed to confirm the diagnosis. Depending on the nature of the presence of other related conditions, medical interventions are prescribed. Surgery may be taken as quick as possible, just after birth of the baby. Bowel or bladder control is also a problem of this group of children. Effective training can help the child to manage the bladder control. Children with Spina bifida have normal intelligence, or in rare cases their IQ, their intelligence level may be affected. According to the needs of each and every student with Spina bifida, the enrollment should be done either in the special class or in the inclusive class. School personnel can contribute to the well-being of these students in several ways. What are these ways? Making sure class layouts permit students to move effectively through classrooms and other settings with their crutches or wheelchairs. Supporting students' efforts in using various bladder and bowel management procedures and ensuring appropriate privacy in using them. Requiring these students to be as responsible as anyone else in the class for customary assignments. Involving them fully in field trips, physical education, and other school-related activities, and communicating regularly with parents. Additionally, if the student has a shunt, teachers should be alert to signs of its malfunctioning, including irritability, neck pain, headache, vomiting, reduced alertness, and decline in school performance. As with all physical disabilities, collaboration and cooperation among all caregivers are critical to the well-being of each child or youth with Spina, Bifida, or with any type of physical disability. So thanks, my friends. These two topics, one on spinal cord injury, the first one, and this one on Spina Bifida I have described. If you face any kind of problem, you may raise the question in the box. You can send it. I'll try to my best to answer the questions. Thank you all. Thank you.